Hello friends, welcome to another edition of Healthify with Dr. Niyati. As you all know, Healthify with Dr. Niyati are also WhatsApp groups. These groups are silent groups, only admin groups, and I open them on every Sunday so people can ask their queries and their questions. Rest of the week the groups are closed. If you would like to be a part of that group, you can message me on the number I've given in the description box. Also, after this video, if you have any doubts, then don't forget to ask them. If you are new to my channel, do consider subscribing it, and don't forget to press the notification bell icon. That is because we are coming with many live videos, especially on reading and a recommendation of which books and a synopsis of that book on that particular day. So you will be sure to get a notification about that particular program. Today's topic is a very special episode on the occasion of International Women's Day. I'm taking up topics which are very close to the heart of a woman. So the first topic is the life of a woman from menarche to menopause. As we all know that in the life of a woman, since she is about 12 years old till she becomes about 55, she has her periods. And it's become a very worrisome problem because girls do not know exactly why they are getting their periods, what exactly change is happening in their body. And even the mothers, many a times mothers are now quite elderly, and hence they have also quite forgotten what happened when they were having their menarche. So remember this, that I usually relate that age to behaving like a monkey, because I believe that all the hormones that are circulating in our body do make us at times behave like monkeys, and I'm sure all of you women will agree with me on that. So it so happens that a straightforward girl who is very gentle and soft may suddenly become very aggressive, and the mother is like at a loss that why she is so aggressive. Or if there is a girl who is very aggressive and talkative and in general very extrovert, she becomes very introvert when she gets her periods. So these are the changes which mothers, I think, need to look into and remember what their menarche was like. So what happens is that there are hormones like estrogen, progesterone, as we all know, also FSH and LH. These hormones, they they trigger other hormones, like they trigger adrenaline or thyroxine, T3, T4, anterior pituitary. So there are many hormones in the life of a woman which she has to deal with. These hormones, remember friends, are circulated in our body at night. From 10:30 to 12:30, these hormones are circulated in our body, and at that time we should be asleep. Strangely, things are changing now, and most girls and women are awake at that time, causing the major problems in the life of a woman. If she is still menstruating, she'll have severe pain and cramps in the stomach. She might have menorrhagia, that is too much of bleeding. She may have less bleeding, or she may have regular cycles, but she may have problems during menopause. So remember, some things are good done in the old-fashioned way. That is, early to bed and early to rise makes a man healthy, wealthy, and wise. This statement is really so true in the life of a woman. So try to change. So change doesn't occur like in one day. You will need to reduce your hours of being awake at night slowly but surely. We could start with half an hour, maybe 45 minutes, 15 minutes in the beginning if you like. And slowly you will realize that it's very possible to sleep early and wake up early and finish all our jobs during the day. So very important is a woman's life. So as I said, menarche, be sure to tell your daughters what exactly the period is due to. Maybe women do not know it, then you could take them to any of your family doctor, your gynecologist. Like a doctor like me would also explain to your children what exactly is coming of age or getting your periods. Now, as the age of a woman advances, she becomes a pre-childbearing age, then the childbearing age, then the post-childbearing premenopausal age, then the perimenopausal age, menopause and postmenopause. These are the stages in the life of a woman. So before she becomes a mother, I advise women nowadays and girls, I will say girls, before they're getting married, to see to it that they exercise vigorously and not remain standing all the time. Do some work sitting down on the ground. If possible in houses, if it's possible to sit on the ground and eat food at least at night, it will be a very good habit, especially for women, because I've seen nowadays the condition called as placenta previa, means the placenta getting attached to the lower end of the uterus, is becoming more rampant nowadays, when it was not so common in the olden times, because women were generally very active. So being active, if you're on your toes, be active, but also see to it that you do something sitting down. See that you relax and lie down also at certain times of the day, flat on your back or even prone on your stomach too. So these are the things a woman should practice before she is going to get married. After marriage also, there is a different total change in the life of a woman. So in that, she should see to it mentally that if she is the head of the family, then she incorporates the whole family in small jobs that are given to the family. See to it, it's really healthy, because as we have also again the old fashioned, a family that works together strays together. So she helps in keeping the family together. So it's very important, because then when she bears a child, the family takes up rest of her responsibilities also, and then it's all like a joint venture. The whole venture of having a baby, everything becomes very easy for her. As the childbearing age finishes, women at say 40, 35 to 40 generally tend to put on weight, and they say it's premenopausal, or like 30. But remember, at 30 and 40, a woman starts getting sort of settled in her life, in her family life also, and in her workplace also. So a sense of settlement when it comes on to us, then that is the time we generally tend to put on weight. So see to it that at that time you change your exercise, you make a different pattern of exercise, so that it helps you in your life ahead. So then comes the very close to menopause. So there are two types of menopause I've seen, that some women bleed a lot and some women start reducing to bleed and they stop. This is the natural course that a menopause should take, that women should stop bleeding slowly and then they should stop. But many a times we see that women suffer from severe menorrhagia also. Maybe it's even hereditary. Their mothers also have suffered from such a condition. So full body, overall body acidity triggers this extra bleeding. So when you have menorrhagia, do consult an Ayurvedic physicians, because there are many Ayurvedic medicines which help in thinning the endometrium. So as age advances, the endometrium has to thin. So there are many Ayurvedic medicines which can help you in thinning your endometrium. So these are the steps in general in the life of a woman. It's always good to know what these stages are. So I'm coming with separate videos on each of this stage, what you should eat, what you should avoid, so that you get a general picture of what your life is going to be. So this is going to be my gift to you of Women's Day, and I hope you like it. Do comment, do tell me if you like these videos. You can tell me some other subjects also if you're interested in, and I will make videos for you on those subjects too. Thank you for being a part of Healthify with Dr. Niyati. Do continue with your support, and like or comment and tell me how you like these videos. Thank you.